Welcome, everybody. Thank you so much for being here today to talk about enhancing eating disorder treatment, measurement-based care, and the value and impact that it has on eating disorders.
People are struggling. The criticalness of those struggles is very high. They're not accessing the support they need, and the right funding isn't in the space to really help drastically improve. So traditional measurement is a reporting exercise that doesn't provide clinical value throughout the treatment process, but just an indication at the end of care whether a person has improved, and also doesn't let you know why that improvement has happened. Measurement-based care essentially flips that model on its head, starting first and foremost with clinical value for the client and clinician. Clinicians can then identify when they're improving, more importantly, when they're regressing, and identify and address it before that person may regress into crisis or have more acute needs.
A lot of times, patients get discharged right when they're actually feeling the most fragile in certain ways, and we're kind of letting our guard down. Looking at all the data using measurement-based care can really help you be careful. So there was a patient that came to Within that had a prior history of an eating disorder that began in college. In a nursing assessment, the nurse actually was the one that noticed his PHQ-9 score was 25. In the sessions, he wasn't saying, I'm severely depressed, I'm miserable. So in the conversation, though, some of the interesting things that you can ask the patient, does how you're feeling match what the score is? It definitely affected his care. That PHQ was really what alerted us that he was much more depressed than he was actually articulating. I think it actually saved his life. So you can see the drastic change in the PHQ-9 and all the scales, and it's just a really validating experience to see something like that. And one of the things that we've done is we continue to use measurement-based care post-discharge, which is a big thing, but it's okay to start small. Just pick 2 measures and go from there. And this just shows you the core measures, the EDEQ, the CIA, the intuitive eating scale, QH9, and the GAD-7 is what we're using at Within right now. My take-home point is that it sort of becomes the fabric of treatment. It is really a part of treatment. It's not a sidekick. We use it first for patient care, second for quality improvement, and third for research, but it's the pillar of all of this work that we're doing at Within.